Yesterday, the House Select Subcommittee on the coronavirus pandemic concluded its two-year investigation into the COVID-19 pandemic and released a final 520-page report on the lessons learned the path forward. Basically, how do we respond in the future? Well, what were the takeaways from the report, and how will it help to protect the citizens of the United States, not only from the next pandemic, but also from the failed responses that we saw from government? Here now to discuss this, Dr. Robert Malone, Chief Medical and Regulatory Officer for the Unity Project. Dr. Malone is internationally recognized physician scientist who specializes in advanced development of medical countermeasures to infectious diseases. Dr. Malone, welcome back to the program.
Thanks for having me on, Tony. It's an interesting time and an interesting report.
It is. How thorough, before we go piece by piece, how thorough of a review was this of the pandemic, in your opinion?
So there's areas that it was quite thorough and aggressive, in part because it had the ability to subpoena and to hold classified hearings. There is a lot of concern and complaints that the committee did not delve into, in particular, the adverse events associated with the vaccine. Mm-hmm. This is revealed in part through the odd juxtaposition of a very strong endorsement of Operation Warp Speed, immediately followed by a statement in the committee's summary that the vaccines were their effectiveness was overstated, their safety was understated, it was not acknowledged, the adverse event profiles, and the committee specifically said that the vaccines were very ineffective in preventing infection and disease. So that juxtaposition of endorsement of Operation Warp Speed followed by a resounding lack of endorsement of the efficacy and safety of the vaccines is another thing that a lot of people find perplexing, and speaks of a compromise within the committee and kind of the usual DC process of speaking out of both sides of one's mouth.
Yeah, it's like we got this thing done very quickly. It didn't work, but we got it done.
Yeah, and it didn't work, and it caused major health concerns, impacts, and you can pick that out. For instance, one of the other committee comments is that those that were harmed by the vaccine are not being efficiently and adequately compensated by the process. So there's a lot of contradictions here. It clearly represents a consensus document after 2 years of arguing. We saw that arguing very clear in a number of the public testimonies, including with Dr. Fauci.
Right.
But all in all, the comment also is, well, we knew all that stuff. We've heard it all for the last 4 years. Yeah, but you didn't have an official congressional statement on that.
For instance, the origins of COVID-19, it appears that they've settled on the idea that it did come from the lab, something that was said at the very beginning and was refuted by those in government.
And you've cited the CNN report on this topic, in which CNN is still dug in on natural origin and is denying and obfuscating the importance of the committee's decisions and conclusions regarding the laboratory origin. But throughout much of the world, this is considered to be the truth is that this was an engineered virus. And as the committee correctly points out, it has characteristics that are not found in nature, and it has the characteristics of a single point of emergence into the population at Wuhan, adjacent to the Wuhan Institute of Virology.
Let's talk about the mitigation efforts that were undertaken by the government, in particular, distancing, masking. You mentioned the vaccines. They came to the conclusion that most of us in America realized very early those things didn't work.
They did, and they also were quite critical of the governor of New York, Cuomo, and the actions that he took in the context of the elderly and the nursing homes. And there's indications that that's been referred to DOJ. The committee did endorse in a soft and squishy way aspects of the testing program that was done as a public-private partnership while acknowledging that the testing had significant problems. So there's clearly an attempt here to be fair and balanced and to take into consideration the positions of the minority.
The big question is, will this have the impact of preventing the failed attempts that were taken during COVID-19 to, if any future pandemic arises?
Forgive my cynicism on that. I don't see the federal government at this point in time taking these suggestions in and acting appropriately to respond to them. This should be a very active lessons learned, and there's openness and transparency. We're not seeing that, and I'm unless Mr. Kennedy is confirmed and his appointments are successful in moving forward transparency and accountability, I very much doubt we're going to see it. And you can see that as many of the same players are now ramping up fear about the avian influenza.
Right.
Sorry about that. We had a little bit of a glitch.
Yeah.
Thank you.
So we're almost out of time here, but I think one of the things that should happen is under the next administration, the same leaders in Congress should push this forward, making sure that these findings are in fact taken into consideration when policies are shaped by the next administration. Dr. Malone, out of time. Thanks for joining us. Always great to see you. Always appreciate your input.
Thank you, Tony.